our next presenters. Keeping Public Health at the Center of AI, reflection of the ASPPH Task Force report, that is the Association of Schools and Programs of Public Health. Joining us today is Eduardo Ruiz, Chief Information Officer for the Association of Schools and Programs of Public Health, and Jamie Atchison, Senior Director of Innovation and Strategy for the Association of Programs in Public Health.
Well, good morning, everyone. Let's see if I can use this one. So first of all, I'm delighted to be here. I actually really want to recognize Dean Perry's leadership in putting GMU at the forefront and leadership of this incredibly important moment. I will tell you, as ASPPH, we represent over 150 colleges and universities, mostly in the United States, but also around the world, and GMU is leading in this space. And I think that that's incredibly important to recognize that. So what we're going to talk to you about today is a little bit on the state of AI adoption and why it matters to not only academic public health, but also public health as a practice. We'll give you a little bit of background on the ASPPH Task Force for the Responsible and Ethical Use of AI. My colleague Jamie will share some of the recommendation highlights that came out of that report and a call to action, and hopefully at the end we'll have a little bit of time for some audience Q&A. So first of all, just to give you a little bit of background, right now when we're talking about frontier models, it's really important to understand the performance. So Anthropic has released Claude Opus 4.6 earlier in the year, and then followed very quickly by other manufacturers, including Google's Gemini, and of course, ChatGPT by OpenAI. Most recently, you've probably heard in the news that Anthropic actually held back their latest model, Mythos, because they claimed it was too dangerous to release to the public, mostly from a cybersecurity standpoint. And again, if you're a skeptic and don't believe in this artificial intelligence, just keep in mind, as the earlier speaker talked about, it's about knowledge connections. And that's what Mythos does really well. It was trained specifically on code and on data, and so it was really good at identifying weaknesses that had gone unrecognized for decades in a lot of the code sets. Now, some folks claim that this really was a fear tactic to create this sort of fear of missing out. But I've actually been using Claude Opus for the last 2 months, and I can tell you it is incredibly powerful what it can do. And just so that we all level set here, these models can pass the bar exam at 85% score. They can sit for the US medical licensing exam and pass it at a 91% rate. And also, if you look at AI-specific models like the GPQ Diamond, which is a graduate level test designed by PhD domain experts, the Claude Opus 4.6 can pass it with a 90% grade. And then on humanities last exam, even though it's still failing, it does one of the best in terms of LLM performance. So these things are very powerful. And as a result, we've seen the marketplace respond, with over 50% of US companies now being paid customers of one of these LLMs. And you can see the growth within the last couple of years because of the level of performance of these models. Now, in healthcare, they've actually really embraced AI. And 85% of US healthcare systems are now implementing production-level workflows in AI, with 80% of doctors saying that they use it on a daily basis within their practice. And so this actually represents over 2 times adoption rate than any other industries. So healthcare is really leading in the way, and they're leading at every aspect, not only within the back office business intelligence workflows, but they're actually having it patient-focused as well. Ambient scribe is something that if you've experienced that, where you go into the doctor now and they can look at you directly in the eye because the AI is capturing everything and really then synthesizing all of that information later on. The most interesting use case I saw is a digital twin, where there's InHeart is a company that's actually taking all of the data from heart imaging and creating a digital heart so that they can actually, even before the procedure, understand the individual human anatomy. So the use cases in healthcare are really just outstanding. Now, public health as a profession has lagged behind a little bit. All of this data also, again, is reported by these various companies, if you can see down here. But about 60% of public health organizations report that they're using AI in production level workflows, but only 43% of governmental public health sector employees say that they're using it on a daily basis. So public health is a little bit behind. Just a side note, this is a little bit old data, so this is from 2025, so things may have changed a little bit, but I think what we're seeing is an emergence of pattern. One of the most concerning patterns is that we're seeing a geographic divide between East Coast, West Coast, and urban areas adopting AI much faster than rural communities and rural public health settings. And this is really going to be an issue that needs to be addressed. Now, in terms of how public health organizations are using AI, it's mostly for community health assessments and community health intervention plans, to analyze grant reports, for disease surveillance and risk modeling. Obviously, sewer water detection being one of the most cited use cases. Now, I think we can all really grapple and get our heads around the fact that AI is disrupting education. And as we've already talked this morning, AI is a double-edged sword, right? So obviously academic integrity, issues with critical thinking, digital inequalities that can arise from students not having access to these frontier models, student mental health as well is an issue. But then also the opportunities for more personalized learning, to rethink our curricula and to really integrate it for some of the cognitive offloading of the tasks that really aren't necessarily critical to public health, so that we can actually improve the learning outcomes. Now, in public health, we've always known for quite a while now that the spaces that you live in, the education that you receive, the work that you do, really impacts your health. We all know social determinants of health, right? And the WHO Commission put out the SDOH from 2005 to 2008. Now, when COVID hit in 2019, it actually exposed the gap. Obviously, we saw social determinants of health at play in the COVID pandemic, but something else emerged. Public health systems at the time were still predominantly paper-based. They were still using fax machines to send in surveillance information to the CDC. And so this concept of a digital gap, of digital determinants of health, emerged out of the pandemic, where we recognized that there was not an equal and even distribution of digital implementation across public health. And so the WHO revisited this and put together a task force where they put out the digital determinants of health, and also CDC responded by the data modernization plan, and we've made significant progress since then. Now, we've already also talked about another moment. Now, this obviously, the release of ChatGPT doesn't raise to the level of the COVID pandemic, but it really is another important inflection point. And as we've talked about, actually, if you're not really into the tech, a lot of the models that are out there have their foundations since the early 1940s. 1947 is actually when the first model came out that was very loosely based on how our brains worked. The perceptron was something that was modeled off of a neuron. Very simplified model of the neuron. But this technology has been around for a really long time and developing over the ages. And With the advent of the GPT, the transporter model is actually potentially a new, different way of thinking and doing things that we've never seen in biology before. And so the capabilities that these LLMs have are actually shifting from the way that our actual, our biological brains work. Now, an also really important aspect of this is that we're now seeing these LLMs actually exert direct pressure on every single social determinant of health. So as we launched the task force on the responsible and ethical use of AI, we really started to think about it and frame it around the fact that AI is impacting every single aspect of public health. And so we're really thinking of AI as a determinant of health, different than social determinants and broader than the digital determinants that we saw in COVID. And obviously, again, the double-edged sword, where we need to ensure that our communities that are underrepresented, how do we deal with them if they're not there in the LLM? How do we grapple with the dramatic impact on the environment from the consumption of power, from the consumption of water? Oftentimes, these data centers are being built in communities that are already underrepresented and underserved, in desert communities. And so these challenges, these environmental impacts are very real. We're already seeing labor market disruption, and particularly in early career, administrative and clerical work. So what is this economic impact from a marketing standpoint going to look like in terms of folks' ability to actually be able to support and maintain themselves? And what I'm actually most concerned about is the confluence with robotics. Today, we have vehicles roaming the streets, making life or death decisions autonomously. We also have AI in warfare, where these autonomous drones can actually take off, target a human, and end them with no human intervention. Now, obviously, the benefits of this, we've already talked a lot about today, but precision medicine at scale, where you can actually take all of that clinical data, you can combine it with genomic data, you can combine it with SDOH data to really impact entire populations. Obviously, this will help with forecasting and prevention. We can also personalize message. Now, during COVID, public health lost a lot of that community trust because we did not provide the right messaging to the right communities. AI can help us. It can help us for folks that we necessarily don't understand, but that AI can help us relate to them better and provide messaging that will resonate with them in their context, in their specific view of the world. And of course, accelerated research and the ability to discover new patterns. So as we launched the task force, we really actually thought about these two facts, that AI is the determinant of health and AI is an educational disruptor. And unfortunately, academic public health is stuck in the middle. And that is a really, really difficult place to be. You're in between a rock and a hard place. But you have to actually take this moment and recognize that not only from the educational standpoint and how you're incorporating AI into your curricula, but also from the public health practice standpoint, you need to be able to grapple and engage. So I'll turn it over to my colleague, Jamie, to talk about the task force.
Oh, there we go. All right, good morning. So that was quite the foundation to set up our what we're doing at ASPPH in terms of what are we doing to operationalize this task force. And as Ed just mentioned now, and with Dean Perry's conversation earlier with Eason, this is the opportunity for academic public health to have a seat at the table. to address how AI is being used, as Ed mentioned. So last year, ASPPH, the Association of Schools and Programs of Public Health, wanted to respond to this moment in time, and it formed a task force. So just to give a little bit of background for those of you unfamiliar with the association will form task forces in collaboration with the board on a timely topic. So last year, this timely topic was AI. And so this task force is chaired by Dr. Ashish Doshi, who is the Dean and Distinguished Professor at the University of Memphis School of Public Health. In addition to Ed and I being on the task force, we also have two of our task force members here, John Arbach and Abdul Sheikh, here with us. So thank you for joining us here and this very important dialogue. So this task force brings together leaders from academia, public health practice, research, industry, and technology to develop these promising practices for responsible and ethical use of AI. The task force deliverables really can be bucketed into three primary deliverables, focusing on research articles, framework development, and implementation resources. Definitely the latter, if there's faculty in the room, you'll be very much interested in. Starting with research, the task force has already published one peer-reviewed article this past April, which is investigating the use of generative AI policies among ASPPH member schools and programs of public health, and that is in the frontiers of public health. Second is the job task analysis, which is currently under review right now. And lastly third is a research article, which is currently in progress on existing programs that offer AI in its curriculum within schools and programs of public health. Second, looking at the framework report, we worked together with the task force to create an executive summary. This framework provides guidance for evaluating emerging technologies, including AI, machine learning, robotics, advanced analytics, through these 4 pillars within the technology framework. This framework was released earlier this year, which some of you may be privy to. It was released publicly. It was heavily discussed at the ASPPH annual meeting in March, which I know a number of you attended. Also, we provided an opportunity for individuals to provide feedback throughout the entire process of drafting this digital report. In addition to the full report, there is a one-pager recommendation that individuals can access and circulate, and we are always welcoming feedback throughout this process. The final report will be released later this week, so stay tuned for that. We are socializing this quote-unquote final report with our section members at the sections retreat in 2 weeks, which make up a lot of faculty and staff at our member institutions. And then later in July with our dean and program directors of the schools and programs of public health at the leadership retreat in July. This will provide our membership to review the report, provide any feedback, and then we will have a broader dissemination plan later this summer. In addition to the framework report and the research articles, where really rubber hits the road is helping out our faculty and staff at our member institutions. So we are hearing loud and clear that faculty need help. So while there are some amazing member institutions such as George Mason University College of Public Health, there's a really robust infrastructure. Not all colleges and universities are leading in this space, and they need ASPPH's help. So with that, ASPPH is curating informational webinars with exemplars of how AI is being applied in teaching, learning, and education. We are also going to offer a collaborative learning exchange where individuals can join virtual conversations. It'll be like roundtable conversations where individuals can share lessons learned, share institutional knowledge, share skills, and have a more informal conversation. We also heard from our faculty, our member faculty, that is a learning format that is preferable. And also, we will be providing e-learn modules on the ASPPH e-learn platform. This will be asynchronous opportunities where we will provide courses related to how you can apply AI in the classroom. And also in the future, we will provide modules focused on the other 3 pillars: education, research and practice, and policy and regulatory frameworks. Related to the implementation, if anyone is interested in partnering with me and ASPPH in terms of curating these exemplars and or facilitating these conversations or sharing your use cases, please reach out to me and I would love to speak with you. As Ed mentioned earlier, our main effort right now with the task force is releasing this report. Right now, the draft and the draft report and the draft recommendations are found on our AI for Public Health website. So do scan this QR code. As I mentioned earlier, we do plan to release the report either later this week or next week, so do follow along. There is a mechanism on the website as well to submit your contact information if you would like to stay apprised of what ASPPH is moving forward with our members and broader academic public health community and industry. In terms of the AI task force recommendations, I've been mentioning these 4 pillars throughout the dialogue. The 4 pillars that we wanted to focus on are teaching and learning, education, practice and research, policy, and infrastructure. And together, all of these 4 major areas help the member institutions really think holistically about how AI impacts academic public health. So from the classroom to workforce preparation to research and practice, and ultimately the governance structures that we've been hearing about earlier this morning to support the responsible and ethical use of AI. And there are 20 recommendations that the AI task force came up with, but I won't go through all of them this morning. But there are 4 I wanted to highlight that I thought would resonate with the audiences here today. And then on the previous slide, you saw the QR code to access the full recommendations. But for the first, just to give you a sense of what the recommendations include, is recommending what we call the bridge professional, which I think will resonate with folks in this room. So these are the individuals who can effectively connect the technical experts, institutional leadership, and community collaborators. So as we've been talking about how AI is rapidly accelerating in the field, organizations increasingly need these professionals who can understand both the technical and public health concept. So Exhibit A, ESIN here this morning. So ensuring that we are, educating the next generation. There are more ESINs of the nation and the world. And also Abdul has a public health background at AWS. So it's really important that these individuals can translate across the different perspectives in terms of the tech and the academic public health space. It's really crucial in this moment in time. Second is emphasizing the importance of maintaining the human-centered approach to AI, which Dean Perry spoke to earlier this morning. So we all know that AI can significantly enhance the efficiency of way that we work, the analysis of the work that we do, and decision support. But in this moment where public health is crucial, it's just that public health decisions ultimately require human judgment, accountability, and relationship building, which is really critical. And we all know that the goal is not to replace people with AI, but really to empower people with AI. And a wonderful quote I heard from the CIO at AARP is that humans should be in the lead, not just in the loop. The framework also recognizes that the successful AI adoption begins with education. And as I mentioned earlier, we've been hearing repeatedly as an association who represents the voice of academic public health that we need to help strengthen the faculty preparedness, who then provide that professional development opportunities and build confidence and competency in AI literacy in AI ethics, instructional design, and applied use cases. So we've been hearing loud and clear that faculty need this support just as much as the students do in the classroom, especially as technologies continue to evolve. We know basically there's new tech every day, I feel like these days. So this is a recommendation and also related to where ASPPH is putting a lot of our time and effort this summer and going into the fall to prepare for the fall semester to help support faculty going into this space. We also recommend integrating AI literacy throughout public health curricula. It's really crucial. This goes beyond learning how to use the AI tools. Students can already do that on their own, most likely. But really focusing on how students should understand the responsible use of AI, understanding the limitations, the risks, the critical evaluation of the outputs, and also, I think more importantly, is the agency of when to use it and when not to use it. So as Ethan, your quote of using the meat of your brain was really, that really painted a picture for me. So yeah, ensuring that your students know, like, you use the brain that you have first and foremost, and also know when to use it. And when you do use it, this is how you should use it responsibly, ethically, and still apply the critical thinking skills. And also understanding how AI intersects with the traditional public health methods and analytics is really important to translate. So as I mentioned, these are just 4 of the 20 recommendations that the task force came up with, but together these recommendations really help ensure that today's workforce and tomorrow's graduates are prepared to engage with AI thoughtfully and effectively. In terms of the task force's work, one of the key takeaways is that this work around responsible and ethical AI, that the readiness is really critical, and it's really a strategic imperative for academic public health to be at the seat of the table and decision makers. And we really think the task force believes that those who are really early to understand, early to use, early to adapt will be the best positioned to prepare the students, support the faculty, and lead innovation and research and practice in the academic public health field. So our goal at ASPPH is to ensure that we're putting our members first. We are looking to put resources into helping the institutions approach this transition that we're all in right now thoughtfully, ethically, and most importantly, with the public health values at the center of all that we do, which we've heard from our member faculty and staff that is critical, so we hear you loud and clear. So we all know that AI won't replace public health professionals, but we as public health professionals who understand AI will be better positioned to help shape the future of the public health field. And with that, I'll close with the principle that guided all of the ASPPH task force work, that ethical AI is public health. So the questions that we're asking about artificial intelligence in terms of equity, transparency, trust, accountability, privacy, access, they're all fundamentally public health questions. And we're really at that crossroads of that intersection of higher education, public health and technology, and public health really needs to be not just at the seat of the table, but at the voice and really driving a lot of the conversations about what technologies we use, how technologies are developed in terms of ethical and responsible use of AI. So as educators, researchers, and practitioners, we really have this opportunity, as Dean Perry mentioned, and also a responsibility to help shape how AI is being developed and deployed and also governed to ensure that everyone has a healthy lifestyle in the nation and the world. And we also want to ensure that our goals to prepare for AI, but also ensure that AI serves for the public good. And with that, we thank you. We look forward to moving this work together. And again, if anyone's interested in collaborating with us, please follow up with Ed, Ruiz, and I following today. And we may have some time for Q&A. I will see if that's fine with Bob and pass it over to Ed. Thank you.
Any burning questions?
Yeah. Thanks a million. That was fantastic. I'm so delighted that you had an opportunity to unpack all of the critical work of the task force. This is something that we've been talking a bit about, and I know you haven't done scientific study on this, but as I understand, there's a classic framework for the adoption of technology, diffusion of innovations, and how a population might predictably respond. And there will be the early adopters, there will be the sort of the modal adopters, there'll be the late adopters, and then the Luddites. Can you speak to how you're seeing this unfold? You've been at this in a proactive way for several years now. And I'm not asking you to criticize our members by any means, but just to better understand it in terms of where colleges and schools are. I think the framework you're providing in terms of responding to needs is really exciting, but I'm really curious as to where you think we're falling when it comes to early adoption versus Luddite and in between.
Yeah, that's what I can tell you is we've made significant progress from where we've started. And I think it's important to recognize that particularly in public health, historically, there's been, let's keep industry at an arm's length. And initially at the beginning, I would say 3 years ago, that was a significant problem. When we started to engage with our technology partners, we're not going to do this by ourselves. So I think the first thing to recognize is the challenges are too large, the technicals are too complicated. We need that mentality of we're building bridges in public health. So one of the first things that we really tried to do as an association is making sure that we had the right partners that actually mirrored the values of public health. And there are folks in the industry, there is for-profit companies that really do share the similar values. And we have to, I think, recognize that and making sure that we're bringing those individuals to the table. And I think you have two excellent examples here of companies that are willing to engage, willing to support, and making sure that everything is done well and with thoughtfulness. So that, I think, was probably one of the earlier challenges that we faced, and getting our community to recognize that we need industry at the table, we need the for-profit world to really be able to engage with this thoughtfully. In terms of AI, the first reaction was, oh, students are going to use it to cheat, so we must ban it. And unfortunately, there are still institutions that are still on that framework because oftentimes they haven't gotten the guidance from how they should be engaging with this technology from that student perspective. So we're really pushing hard right now to get folks, and I think the needle has moved. The needle has definitely moved over these last few years, especially, where folks recognize that this is transformative and there's no escaping it. The one thing I will say is one of the things that came out of the report is there are students out there that may not want to use this technology for safety reasons, for ethical reasons, for environmental reasons, and we need to also be able to provide those outlets for those individuals that don't want to engage with technology for whatever reason. So we have to actually look at it both perspectives, because I think there is, and I think Jamie had brought to my attention that there are actually now movements of students saying that no, we should not be using this in education. So there's a lot of factors here, but I think the most important thing to recognize is we're not going to be able to do this alone. I don't know if you want to add anything.
Yeah, I feel like this moment reminds me in terms of higher education, at least this is my personal perspective, when there was the introduction to online learning. And I remember the sense in higher education of, no, we are brick and mortar, we teach in the classroom, this is how we teach in the classroom. And there were higher education institutions that did not want to explore and be curious on, well, what would online education look like? And how could we reach students in other areas of our nation and or the world? And I feel like this is a very similar moment where there are higher education systems who are curious in terms of how AI can be used in teaching and learning. also translating that into research and practice and preparing them for the workforce, because the reality is when you're in the workforce, nearly everyone is using AI in all of the different industries. And so I think that there are higher education systems who are leading in this space, Exhibit A, and then those who have been reluctant for one reason or the other. And I think in terms of that piece, in terms of the reluctance as the institution, and also the reluctance around whether it's the individual faculty member, one-to-many students, I think it's really important to remain curious and have that dialogue, and that's what ASPPH is doing. We are having these open dialogue of learning, well, why are students banning it? And asking those why questions and realizing that there are a lot of public health concerns, and they are legitimate. And so I think just being very open and be curious and not, the pushing back of whatever it may be, whether pushing back to online learning a few decades ago to now pushing back on AI, and instead just remain curious and also making sure we're having all of the facts. I think a lot of students, there's some who are not using it because of the use of power and water, yet they're streaming Netflix and Hulu every night, which uses more power and water than AI, right? So again, I think just being curious, having the dialogue, ensuring faculty and staff are having the dialogue with each other, with the students to learn more, do a little fact checking, and to continue to remain curious, I think is really important. But no matter what, I think all of our member institutions will be catching up, because I think it will be like the online learning, where if you don't offer online learning, then you may be no longer relevant due to this age of learning in the US. Yeah, any other questions?
For institutions that do value including AI into their teaching practices, but also worry about some of the AI cheating and plagiarism issues, what best practices have you seen, both in tools and then also techniques to assist faculty and train faculty on that?
Yeah, so we've actually had a lot of good ideation. I think we don't have the data yet because it is pretty new. There are opportunities to really do extensive research, pedagogical research on what's most effective. But what I can tell you is some of the things that I see that are potentially promising is the notion that you need to be transparent about why, when, and how to use AI in the classroom. Students are very responsive to, if you tell them, well, you shouldn't use AI because the objective here is to learn X, Y, Z, and if you use AI, you're going to shortchange that. That resonates with students. They're paying a significant amount of money to go to these institutions. They want to get the most out of it. So what we've seen really effectively, almost at the assignment level, is explaining when you don't allow AI, the why. Why are you not allowing that AI? And hopefully the data will bear this out as we get more data to see if that's more effective. But I do think that that's going to be a really good approach to just letting students have that agency to know and to be explained. I can tell you already, we are seeing parents and students, or prospective students, having these conversations about, is this degree I'm about to enter into going to be AI resilient? So folks are already thinking about that. Am I going to have a job at the end of this? The good news, I think, for public health is that because we are such a human-centric, embodied, community-based, it's going to be very difficult for AI to replace that, unlike development, for example. Developers are getting displaced at an incredibly alarming high rate. I don't think that that's going to be the case for public health. So for us as an association to make those arguments that we are going to be able to provide you with a degree that's going to be AI resilient, because we're leaning into critical thinking, we're leaning into those things. And then when the students come to our classroom, we tell them, you can't use AI here because we want you to learn this specific skill and then once you get into the job, then feel free to use AI. I think that'll work, and we've seen that with calculators, right? We know when, as educators, when we need to engage with the calculator, but when we actually don't, because we need those fundamental skills.
I think we have time for one more question.
Hi. Oh, wow. Sarah Seabrick from University of Kentucky. I just had a quick question about, you talked about the task force collecting information on current programs and different things that are being built. And we're actively building an undergraduate certificate for AI health professionals. And like, I would love to be part of the group who is exploring and talking about this, but also share that with you guys. I assume I'm not alone. I assume a lot of people in this space are probably here because we're working on building. How do we share that with you, or?
We do have a mechanism on our ASPPH website where you can connect with us on the AI for Public Health initiative. There is a way to submit your contact information there. And then as we do continue this research, we definitely will be reaching out to our member institutions related to this effort where we can connect. Ed, do you want to share more?
Yeah, so as the task force wraps up the report, the group will actually sunset, but what we are thinking about doing is we're going to stand up a different, well, not a different group, but a body that's more permanent, that's going to be more of an implementation working group, and we do foresee that that will be the group that will then hopefully drive some of the collection of best practices, use cases, as folks announce. But right now, I will add that as soon as you announce, do put it in our Friday letter. Share it with your other colleagues that you have this new program, because I think that that's also going to be a good mechanism of sharing through our Friday letter newsletter. And actually, her team just implemented that new feature so that we can do that. Symposiums, different things that you might announce, partnerships, we'd love to collect that, because that will be a source for us to then mine later on, and then perhaps invite you to provide your feedback. So, but we probably will come up with more formal processes for collecting this particular information. Our institutional research and reporting arm, which if you're not familiar, every year we collect data. We might talk about how, because AI is moving so quickly, how we can incorporate some questions into that mechanism. Obviously realizing that it's an additional burden to report, but we want to know what folks are doing and how they're transforming.